Hello, welcome to the Health Workforce Technical Assistance Center's webinar series. This webinar is entitled Immediate and Long-Term Economic Impacts of the Pandemic on the Nursing Workforce. And it was presented by Peter Buerhaus and David Auerbach on October 20th, 2021. My name is David Armstrong, and I'm the director of the Health Workforce Technical Assistance Center. And today's webinar is entitled Immediate and Long-Term Economic Impacts of the Pandemic on the Nursing Workforce. And this is the first in our new series, which is focused on COVID-19. And for those of you who are interested in viewing our previous webinars, by all means, check us out at healthworkforceta.org and look in our media library. We have about 70, 80 webinars available, all focused on the health workforce. Now, before we get started, I would also like to announce some upcoming events. We have 2 more webinars in this series scheduled for the remainder of the year. The first is on executive orders addressing COVID-19 during the early stages of the pandemic, and the presenters are Meg Simon and Julie Strasser. And then in December 16th, we're going to look at telehealth utilization during the pandemic with Cleese Erickson and Candace Chen. Now, that said, unfortunately, Doug Steger was not able to make it today. He had a last-minute conflict, but we are going to be entertained by Peter Buerhaus from the Center for Interdisciplinary Health Workforce Studies at Montana State University College of Nursing, and his colleague, David Auerbach, also from the Center for Interdisciplinary Health Workforce Studies at Montana State University College of Nursing. Welcome.
Well, David, thanks very much. And we're delighted to be the kickoff to this webinar. And we'll be talking about the study that we're doing. It's an ongoing study. The title is here, as you see, Determining the Impact of the COVID-19 Pandemic on the Nursing Workforce in the U.S. And we probably know a lot of people on this webinar. So Dave and I say hello and glad that you're with us. Our sponsors are listed here: United Health Group, the John A. Hartford Foundation, the Johnson & Johnson Foundation, and the Robert Wood Johnson Foundation. So in addition to myself, Doug Steger at Dartmouth is a co-investigator, and Doug unfortunately had something come up that canceled him out for today. But Dave Auerbach and Max Yates and Karen Donnellan are also members of the team. So here's our agenda. It's a big agenda, and we're going to try to be done in about 35 minutes so that there's plenty of time for discussion. But I'll begin with a project overview, what this project is about. Then we'll jump right into some employment and unemployment trends for RNs, LPNs, and nursing aides. This was a section that Doug was planning to give. I'm going to sort of start it off, but Dave is going to we're going to tag team this section, and he'll correct me for when I make mistakes or errors or add in things that I miss. We'll get through that, and then we'll turn the microphone over to Dave, who will look at implications for the future workforce. I'll close things up by really looking way back into the 1990s and see if there isn't a lesson for us to be aware of as we now move forward into this decade. Then we'll have plenty of time, I think, for discussion. So that's sort of where we're going over this next 35, 40 minutes. And this is the project. And really what's driving our team is answering these 2 fundamental core questions. One has to do with entry into the workforce. Will this pandemic lead to increases or decreases in nursing education, in enrollment in nursing education programs, which then is a precursor to entrance into the workforce? And on the exit side, will the pandemic lead to nurses leaving the workforce or speeding up retirement? And when you put these 2 sort of questions together, this really shapes the future of the workforce. What happens to entry and exit helps us understand what will happen to the number of nurses as we go forward. So these are the questions that sort of drive this project. It's a 2-year project. We have just finished year 1, and we're sort of transitioning into year 2. What happened? I want to go Yeah, there we go. The first year of the project has really been focusing on the immediate impacts of the pandemic. And so we are gathering data on employment and unemployment. We're looking not just at registered nurses, but we're looking at licensed practical nurses and nursing assistants. We'll be examining employment and unemployment by employment settings, and to see if we can detect if there's any disparities in impact by the nurse's race, ethnicity, gender, or age. We will also be keeping our eyes on the enrollment question and whether there's evidence that the pandemic is accelerating retirement out of the workforce. Then, in addition, we have work done by Karen Donnellan, our survey sort of focus on this grant that's looking at public opinion surveys and surveys of nurse leaders and of nurses themselves, which I'll talk about momentarily. Year 2 is where we're just now transitioning, where we're going to continue these monthly employment and unemployment analyses and the administration of these national surveys. But the real focus is now putting all this information together and seeing about the long-term impact on the nursing workforce through 2030 and forecasting that numbers of nurses. And Dave will talk a fair amount about that a little bit later. So our approach and the data that we're using, most of this comes from the current population survey, and many of you are familiar with that federal survey administered by the Census Bureau. And it's the survey where you hear the monthly unemployment rates and then other data that the Fed uses in examining the economy. Each month, about 125,000 people are surveyed, and we're able to pull from that monthly number about 1,300 RNs, roughly 250 LPNs, and around 850 nursing aides each month. And we're able to obtain these data 5 to 6 weeks usually after a month is ended. So there's not a lot of gaps in time before we can actually obtain data and know what happened in a prior month or so. Now, we're using these data to go back in time and look at what the trends were before COVID, and then also during the pandemic, so we can see how the pandemic has influenced this. And we'll be looking at unemployment as well. So we're looking at employment and unemployment. And as I mentioned a minute ago, Karen Donnellan, who is the Stuart Brandeis Chair at, or Stuart Altman Chair at Brandeis University, is conducting national surveys of the public, which she has done, asking the public, would you recommend nursing as a career, and how has the pandemic shaped your views? She's also surveyed nurse leaders, the executives in nursing and managers in a large number of organizations across the country to see what their experience is with COVID. And now in the field is a survey of nurses themselves, covering a lot of questions, but also would they recommend nursing as a career, and their views about entry and exit. So we won't be hearing from Karen today. We don't have enough time on that, and some of her work is very sensitive. It's right in the field at the moment. Then Dave will, as I said earlier, pull a lot of this information and look at projecting the supply of RNs through 2030. So that's the look of our project. That's where we're going. And I thought I'd start by just taking a big picture, get way up in the sky here and look at employment among major sectors of the healthcare delivery in our country. Now, there's a lot going on in this slide. And let me direct you initially to the top of the slide, and you see February 2020, and then each month going out through 2020 and going up through to September of 2021, a month or so ago. At the bottom, there are the color codes for physicians and outpatient centers, hospitals, nursing facilities, and home health care. And Dave has taken developed this figure from data supplied by the Bureau of Labor Statistics that you see here at the bottom. Now, as we look at this slide, here's where we were in February 2020, just at the before the pandemic started. But look how quickly employment, now we're talking employment, drops precipitously in March and April as the pandemic begins. Really, it wasn't a pandemic at that time, it was COVID, but man, things didn't have to take much time before we saw a very, very sharp decrease, and particularly in the offices of physicians. Now, as you kind of follow the slide to your right and go across time, whoops, you see that the sectors are starting to rebound, and by October of 2020, as we're into the beginning of the I'm sorry, this is very sensitive, and I have to keep my hands off this. So you're looking at the top, the outpatient care centers had already recovered and were exceeding employment levels that were occurring pre-pandemic. So they've recovered the fastest and have maintained that. But below that, in the dark blue, these are offices of physicians. They generally come back. They're just a little bit below where they were pre-pandemic. The gray bars, that are the lines, those are hospitals. They've not yet ever fully recovered, and they're remaining about 2% below in total employment compared to the pandemic. And that sort of lighter blue are home health care, and they too have not fully recovered. Employment is down almost 4%. Now, the big yellow line just stands out, and you can see these are nursing homes, and they didn't decline as fast as others initially, total employment, but they have never recovered. It's been a steady decrease over time. When we were out sort of earlier in late spring of this year, we thought maybe nursing facility total employment had stopped dropping, but then more recent data shows it's continued, and now it's 15% below what it was prior to the pandemic. So that's sort of a big orienting slide. Now we're going to get into some of the results that, this is where Doug was going to come in, and I'm going to sort of start us off, and Dave, feel free to jump in at any point and make notes or corrections along the line. But now we're going to look at the impact directly on RNs, LPNs, and nurse assistants. Now, this first, oops, this isn't right. There, total, there we go. We're going to look at total employment trends for RNs who are in green at the top, for nurse aides who are that blue line in the middle, and LPNs at the bottom. And for the top of the line, RNs, you can see that going back 10 years of data, that RNs have been the only component of the workforce that have been growing, and roughly about 2.4 million in 2011, and it reached just to about 3 million just before the start of the pandemic. But with regard to the middle line, aides, and the bottom line in sort of orange, LPNs, pretty flat employment growth over that 10-year period. But then when you get to the COVID experience, you see all three workforces employment begins to decline. And over here, the bullet points, you can see that RN employment has declined by about 5% through the second quarter of 2021. For aides, the middle, it's been a larger decline, around 10%, but the largest decline has been with LPNs at roughly 20%. So a pretty important decreases in employment. Now, we'll look at earnings, and these are average hourly earnings adjusted for inflation. And immediately when you look at this slide, and we're going again way back to 2011, you see a very flat picture lines for each of these components of the workforce. And RNs at the top, LPNs in the middle, and nurse aides on the bottom. But when you get to the pandemic, and once the pandemic gets going, you see an increase in RN earnings of roughly 2%. For LPNs, it's around 9%, and for nursing aides, around 6%. So this combination of falling employment and earnings increases are consistent with a picture of shortages that may have been beginning to develop as early as sort of by the end of the first quarter of 2021. Now we're going to switch over to unemployment. And there'll be 4 slides that will walk us through. And each slide will, you'll in this case, we see RNs, LPNs in the middle, and aides. And we are averaging each, we're taking the quarters, each month of the data, we're averaging them, the months together into a quarter, so that we have easier way of conveying the information in the slides. But so this is looking at unemployment for RNs, LPNs, and aides total. And you can see that for all of them, there was an immediate increase in unemployment when you get into the second and third quarter of 2020, when the COVID disease is really raging and spreading. And you see this increase in unemployment for all 3. Now, for RNs, this increase that goes from about 1% to a little more than 4%. This is equivalent of about 100,000 RNs who were unemployed at that time. Now notice there's a pretty quick rebound, and by the end of the second quarter of this year, we're essentially back to pre-COVID levels. LPNs, sort of a similar thing. We have this increase in unemployment when you get out into into the third quarter of 2020. This increase is equivalent to about 25,000 LPNs, but then unemployment falls and comes back to roughly pre-pandemic levels. Aides, same thing, a pickup in unemployment, and this is about 30,000 aides that we're talking about who in terms of unemployment. But unlike LPNs and unlike RNs, that unemployment rate has not come down to pre-pandemic levels. So unemployment remains up for aides. The next slide now looks at, again, RNs, LPNs, and aides. And now we're looking to see, are there differences according to the race and ethnicity of the nursing workforce? And what you see is that RNs who are white are in the green, and LPNs the same, who are white, and aides who are white are all in green. And then everybody, unemployment increased for everyone in either the second or third quarter of the pandemic of 2020. But for RNs, people of color, their unemployment rate is higher than it is for whites. So it fell, but then increased and remains today at a slightly higher rate for RNs. That is about 16,000. This increase here is roughly 16,000 RNs of color. For LPNs, similar increase in everybody, but it's basically return, where there's not much difference between whites and people of color, whereas for aides, the difference continues. So people of color who are nursing aides have higher unemployment rates, and that's roughly around 30,000 aides. So next, RNs, LPNs, and aides, we're looking green in hospital settings, and in all other hospital settings is in red. And the big picture here is that unemployment was always lower in hospital settings. Didn't matter if you're an RN, if you're an LPN or an aide, compared to all the non-hospital settings, which had a higher unemployment rate. So unemployment rose across all sectors, but has fallen and come back to pre-pandemic levels in hospitals for RNs, LPNs, and even aides, where it has remained above pre-pandemic levels for non-hospital settings. So the unemployment story is bigger for people of color other than LPNs, and it is bigger for non-hospital employees. And then finally, this slide shows hospitals in green, nursing homes in red. The story is very similar, where you see lingering high unemployment in nursing homes for LPNs and aides, and even a little bit for RNs as well. So I'm going to stop there. And Dave, if I messed up, you didn't jump in, but you can correct anything I said. I think I actually got a few numbers wrong. I was mixing up a few things, but we could come back and correct that later. Otherwise, I'm going to turn it to you to look at the implications for the future.
Okay, thank you. No, I think that was pretty good. I imagine there might be questions. If there are questions about the data, then we'll try to take those at the end. But no, I think you got it right. Thank you. Okay, so I'll talk about forecasts and implications of some of this. And as we said in the very beginning, that data that Pete showed is through June of 2021 of this year. And part of what we're interested in is those effects are fairly large and important in themselves. We're also looking for, what does this mean for the future? What does this mean for the long run? And I'll talk a little bit about that. Okay, well, and I'll try not to be distracted by the questions for now. We'll come back to that. So most of the slides we have so far are really pre-pandemic because we're still waiting for the data to catch up a little bit more, and we're waiting, I'll explain in a second, to rerun these forecasts basically with what we've learned from the COVID period. But most of what I'm going to show you is kind of the setup, is everything we knew up until the end of 2019. What did the forecast look like then? So this is sort of a background and a baseline. Okay, so this first slide is the overall forecast. And even though we just showed some data on RNs, nursing assistants and aides and LPNs, here we're just talking about RNs for this forecast piece. And this is showing you what the model said through 2029. And this is when we had the data just up until pre-COVID, that it looked like, it looks pretty boring. It's about, it was forecasting around a 25% increase in total workforce to about 4.5 million RNs by 2029, continuing trends based on before. And you can think of that 25% increase in light of, compared to a 6.7% increase in the full US population. So that is maybe a 18% increase in RNs per capita over this period. It's a pretty healthy increase. Okay, next slide. And it's helpful to break that down in a few ways. And this is breaking that down by the generation of birth of the RN. And this picture is showing the world's broken down into 5 generations. You see the silent generation born before 1946 in the gray, they have retired. Baby boomers born between 1946 and 1964 in the blue line. And you can see the baby boomers were pretty much the dominant group of RNs from 1980 until around 2010 for 30 years. But since around 2007 was their peak, and they have been retiring, and then you see that's expected to continue as those blue bubbles continue down in the forecast. Then you can see Generation X RNs in the orange, just about ended maybe just about a 7-year period atop the nursing workforce. That's all they get. That's all we get. Soon to be eclipsed by the millennials in the green, who have entered nursing at rates even greater than the baby boomers. very, very high rates of entry, and it's also a large cohort. And you can see that the expectation is for the next 10 years, those green bubbles, the millennials, become the largest group of RNs in the workforce by far over the next 10 years. So that's kind of the dominant trend to pay attention to. And we'll keep that in mind as I go through some of the next slides. Okay, so this is showing kind of in a different way, but the same story that I was telling. This is showing for any year of birth, what is your likelihood of becoming an RN? And you can see that that rose steadily for folks born in the 20s, 30s, 40s, 50s, and it peaked in around 1955, kind of in the middle of the baby boom. That was the highest likelihood up until then of someone becoming a nurse. And to put it into numbers for you, it's someone born in 1955 had about a 2% chance of growing up and becoming an RN. And then that went down. That went down as you got into the 60s. And that there's a number of reasons for that I won't get into and we don't fully understand, but you saw that with nursing school enrollments dropping in the 90s, in the 90s and into the early 2000s. And that was where we forecast huge shortages that would have come to pass if that didn't turn around. And now you can see that it did turn around, where slowly through Generation X and then with the millennials, the likelihood of becoming a nurse really started to skyrocket again. And by the folks born in 1996, the last cohort that we've seen so far, they were more than 50% more likely than those peak 1955ers to become a nurse so far. Okay, so that's what's led to that continued growth of the overall workforce. Next slide. And so taking those pictures I showed a second ago, you can also think of that as what does the age distribution of RNs look like at different points in time? And this graph is just showing that, in 1979, we had a very young workforce with about half of RNs below age 35. And that's never happened again since then. That was really just the dominant of the baby boomers. By 2009, we had a very old workforce because the baby boomers were the largest group by far and were at their peak. And in 2009, about 38% of RNs were 50 and over. But since then, as the baby boomers have been retiring and millennials have been entering, the workforce has shifted back younger again. And that's where we are now. And that will continue to happen even more so over the next 10 years. Okay, next slide. So now that we have a sense of some of the dynamics, here's the most important things that we're looking for in the new data that will affect the forecast. And there's different impacts. So you could have impacts on the entry side. And that is very important for the long run. So and we don't know if this is true, if young adults are discouraged from entering nursing, for example, then you could have a depression of new entry. And what that means is you won't see an effect on the total workforce in the immediate sense because the number of newly entering nurses every year is just a small fraction of the full workforce. But in the long run, that'll really have a very big impact. And we do have at least one signal that could be happening, the growth in total applicants to nursing. It grew in 2020, but it was slower growth than it had been. But we're really waiting to see more recent data, what happened in 2021 before we can be confident about that. But this would be a gradual effect, but it would eventually, the new entry is, if that forecast millennial peak that we showed in the green, if that is less, then that has a big impact. On the exit side, it's a bit different. If there's a wave of early retirements, and on that side, we have seen some evidence of that. We didn't show it in a graph, but that we have some signs that, as Pete showed, the RN workforce has dropped a bit as you get into 2021. And we look by age and we see that drop as a little bit faster for folks that are over 50. But one important point to note is the data we're using. It's great that we have data that's so recent from the CPS, but the sample sizes are also relatively small. So we can't slice and dice those data very finely. And this effect of the older RNs, again, we need more data. It's not quite significant. But if that's true, if you have early retirements, that'll be a sort of a short to medium run drop in the workforce totals. And it's a lot of experienced RNs leaving, which is really important for those for the staffing of those units, for example. But 20 years from now, they were all going to retire anyway. Even 10 years from now, most baby boomers will retire. So it's not the same kind of a long run impact as on the entry side. Okay, next slide. All right, so that's sort of where we are in the forecast. We're waiting for a little bit more data to then rerun it and to see how do things look now compared to where we thought we were before COVID. Okay, so I'll go back to Pete and I'll look at some of these questions and think about them.
Okay, thanks, Dave. And what we thought we would do is, Dave was making the point, I think, that the entrance into nursing, though it may initially not have a major impact in the first couple of years, it could really wind up and be something significant. And I wanted to come back to that point and make some observations on this. And this is what Dave was talking about. This is really heavily influenced by entry into the workforce. And but we don't have that yet. This model assumes that entry will continue at rates roughly what we've been seeing. And that isn't yet a reality, but if we want it to be for this to grow. Now, what I want to inject here is a little bit of discussion around our current messaging of the workforce and of the major employer where so much of the issues are hospitals. And I feel in some sense that we may be on the verge of repeating a past experience that I want to draw out. Much of this current imaging has, particularly over the last 6 months, become negative. It's tweeted about constantly, daily, hourly reporting, and it's mostly about very sort of a negative portrayal of nursing and of hospitals. And a lot of blame towards hospitals. And I feel that we've got to be careful about that because we could risk repeating the past. And by that, I want to take us back to the 1990s. Now, some of you may remember this, some of you may not have been born then, I'm not sure. But I want to come back to this because this was the big decade of managed care and hospital restructuring. Now, what was going on is with Medicare and Medicaid coming to being in the mid-60s, we saw hospital and overall spending go up and costs go up. The 70s was a decade about using regulation to control those, didn't work out so well. The 80s was prospective payment and DRGs, had some effect, but still not getting the job done. 90s was a decade of let's try market competition and market forces through HMOs, and we'll also tinker with physician payment. Now, what happened in the 90s was that as hospitals were now under pressure to lower their costs so that they could keep their prices competitive and win contracts with HMOs, they had to reduce their costs. And since they're in a labor-intensive industry with RNs, their largest group of employees and among the highest earning employees, hospitals started to slow the growth of their employment of RNs. Never dropped negative, but the rate of growth during the 90s dropped from 3% each year of RNs down to 1%. But hospitals also reduced the employment of nursing aides, of LPNs, and others who supported RNs in these institutions. After a while, and some now may remember this, there was a large assertions of poor quality and safety. And it got to the point where there were marches, a lot of them across the country, but intensely in Washington, D.C. Congress took notice. An Institute of Medicine study was funded and convened and to look at the adequacy of staffing in hospitals and nursing homes. And then what we had by 2005 through 2010 was a decrease in interest in nursing as a profession and enrollments and graduation programs. So this was sort of a consequence of this years of repeated negative imaging. Now, there were other things probably going on at the time too, but this is very, very sort reminiscent of what we're seeing today. Here's a look at data we published in a book we did years ago. And this drop in interest in nursing among college freshmen that began from roughly 94, 95, all the way down into the early 2000s. So interest in nursing dropped. And look at the decrease in RN graduates. It had topped up to about 97,000 by 1995, but then you can see these are total graduates of all different programs, but then it started declining. And these are large decreases. So in 95, it's 97,000 graduates. 5 years later, in 99, it's 67. So a 30,000 annual decrease. And even in 10 years later, in 2005, we only got back about half of that, so 84,000 graduating. Now, so these sort of constant imaging really had an important impact on interest in nursing, enrollments, and graduations. And not surprisingly, by 1998, hospitals across the country were beginning to report shortages of registered nurses. And by 2001, you see these large numbers of vacancies in hospitals. And this was really the last large, big national nursing shortage where hospitals across the country affected. Didn't matter if by type of nurse, ER or med-surg or whatever, it was across the board, large numbers, and had a major impact. And so that led to the J&J campaign for nursing's future coming in, and with the help of a recession and somewhat due to the 911 effect of people thinking about becoming a nurse after 911 occurred, those combined to bring back enrollments and interest in nursing. And if we had time, we could look at sort of the recovery of that. But today, we've got a very similar messaging, very negative. Something happens in one hospital, give the internet 20 or 30 minutes later, and it's happened across the country. And it continues. And I'm concerned that if it goes unchecked and we don't see positive messages, we could find ourselves repeating the 90s. And if we do, the slide that Dave showed about a projected growth in supply is at risk. And so I just sort of wanted to leave that here. This is just sort of a worry. It's not yet showing up exactly in the data. It's just something I think we all need to be very much aware of. So in other words, we need a lot more positives and less negatives about the profession, so we keep that interest in the profession up. So I'll summarize, and Dave, jump in at any point here. But year one of the grant, we've got our mechanisms up and going, the data, everything's sort of working well. But we do see a tightening in the labor market, suggestive of shortages back in as early as late June. With falling employment and rising wages. The unemployment rates remain higher in non-hospital settings and among RNs and nursing assistants who are people of color. Now, Dave said the next phase is we'll be looking at these data, survey information that Karen provides us, looking at applicant data for 2021 to see if that trend we saw in 2020 is confirmed, and then head full force into the projections of the future and seeing how well those projections that Dave showed a minute ago, using data up through 2019, how well those will hold up later on. So I think that ends our discussion. David Armstrong. And so I'll say we're done at this point, and I think there's time for some dialogue.
Well, there certainly is a number of questions that have came in for y'all, both in the Q&A panel and in the chat. And so I'm not sure we can get to them all, but we'll do our best. early on during your presentation, there was some more methodologically oriented questions. Perhaps we can tackle a few of those first, if that's okay. And if you don't know the answer, you can blame Doug for not being here. Does that work?
That works.
All right. Well, earlier on, when you're talking about like health sector employment, a question came in. How are you accounting for the fact that NAICS codes will include individuals employed in those healthcare sectors that we don't traditionally consider healthcare occupations, such as finance, administration, maintenance, cleaning, etc.? There's been a lot of this continuation. There's been a lot of anecdotal stories about hospitals laying off individuals who weren't essential in an effort, especially at the beginning of the pandemic, to keep people safe. Couldn't some of these unemployment changes be reflective of decreases in payroll, NAICS healthcare, but not essentially healthcare occupations?
Yeah, I can answer that.
Yeah.
It's a good question, and I think now that we've given the full presentation, you can see that number one, I would say we didn't really put a lot of emphasis on the graph. It was kind of to orient folks to the larger picture and really how the nursing home sector just stands out in terms of just a very large decrease in employment that has not come back. And so that's a fair question. And it is also, I think, just brings out kind of what might seem like a disconnect, because we're hearing constantly, hospitals are strained. They're over, too much capacity, they're understaffed. And here at the same time, we're showing, their employment overall is 2% below it was. How can that all be true? And some of the suggestions in there might be part of it. Yeah. Number one, there's different experiences at different hospitals. And number two, they probably are laying off different kinds of staff. But most of the bulk of this work is, we then pivoted from that to really focus on RNs, LPNs, and nursing aides and assistants. And so that's possible, but it's not our focus.
Okay. Thank you, David. Another kind of methodologically oriented question. Were there any data from nurses in community-based long-term services in support?
From community, pardon?
CBLTSS, I believe, community-based long-term services and support. Any data for nurses in these occupations? And I believe that's a no, correct?
That's too fine of a setting and isn't tracked in the CBS.
Yeah, and those, because you only had about like 1,200 nurses in there, and so it's some of the larger occupations, yes.
Yeah.
With more robust data, are you planning to forecast at the state or regional levels?
Great question. I could take that one too. I guess there's two answers to that. With the data that Pete showed on those trends so far, not with that data. That's the CPS, and that data is, again, too small of sample size to be able to do that. We have done regional forecasts, so still not at the state level, but we can get down to the 9 regions of the US using the American Community Survey, the ACS. And the ACS data is not available with the same immediacy as the CPS, of course. We're still waiting for ACS 2020. This is a larger sample. It's 1% of the country. It's based on the census long form, and that brings in about 40,000 RNs each year. And then there's a small caveat to that. Another problem is that the 2020 ACS was messed up because of the pandemic. It's going to come in later, and it's not going to be as reliable. So we'll still see what we can get when that data is available, but it's going to be a little harder. It'll be a little longer until we can do a regional forecast, unfortunately.
David, that's why we wanted to be first on this webinar series, because we're going to have to confront that issue, and we'll see. We're keeping our fingers crossed.
Yeah.
Okay, great. And another question, can you elaborate on RN unemployment rate differential between white and non-white nurses? Do you have any explanations for it at this point in time?
We've talked about this to understand this and really look at this. And we could maybe speculate, but this data just doesn't allow us to delve deeper into that. We've tried a couple of things, but so I would say, just if we're looking at this data, no, I don't have an answer that's empirical based, but there may be some ideas out there, and others might even want to contribute to that. But that's my answer. Dave, what do you think?
Yeah, nothing else to add beyond that right now. We're talking about it with folks that we know, but please do feel free to offer suggestions.
Okay, thank you. Another question, and now, like I said, unfortunately, I'm not sure we're going to be able to get to all of these today. We do appreciate your interest, however. While unemployment data indicates that our unemployment has returned to pre-pandemic rates in hospitals, but it doesn't seem like that with the intensive recruitment strategies currently in place. How can that be explained? Do you have any explanation?
Yeah, I'll try something on that. It's a great question. And when I talk to people in Massachusetts, for example, and we all know what's happening with, there are a lot of stories about the travelers making really high wages and high premiums, and that hospitals are just really struggling with, a lot of them, with finding enough RNs. And I mean, on the graphs, we did show that, I'm not sure Pete pointed this out, but at least when you're looking at RNs in hospitals, those unemployment rates even look like they are now even below what they were in 2019, which were low to begin with. And so I think, kind of what's happening is for the hospital staff RNs, especially where there's kind of on the front lines and, in the midst of the pandemic, absolutely, that they are having a hard time finding staff. And so that's one story. And then you can overlay that probably with, but perhaps in other parts of the country and in other settings, there's a lot of care that still hasn't even returned from pre-pandemic levels, as we were showing, a lot of kinds of discretionary care. And so you really have different stories overlapping at the same time. And that's why sometimes the things that we hear and the things that we see don't always reflect in the total average picture, I guess I would say.
All right, thank you. That's definitely a good explanation. And here's another question. How will our nursing faculties grow to be able to accommodate such a large projected increase in RN students?
Yeah. Do you want to answer that, Pete? Right? How are we expanding?
Yeah. So the whole nursing faculty shortage piece has been a little bit complicated and confusing to me, since we've been hearing about this since about 2006 or 7. And I have been sort of waiting for the shoe to come down and really see, this shortage is so bad, we don't have the ability to, graduate all the number of nurses we have. But we've steadily grown the numbers of graduates year after year after year. And maybe we could have grown them even more had we had more faculty. I'll submit that. But I think that sector has been innovative with distance technology and internet-based and growing simulation, that for some reason it's been able to accommodate and still grow the workforce. I don't know if there's an upper bound to that or not, but I do know that the age of faculty is the highest, I'm pretty sure, of all sectors of nursing. And some of that retirement is probably a good thing, because many of those faculty were not born at a time when value-based payment was sort of coming through, or are not, comfortable in teaching sort of a new economics of the nursing workforce that is sort of waiting for us as we get through the pandemic to really come to terms. And so I'm sort of not disappointed that there's retirement, and I'm perplexed that if it was so bad, why are we still growing so fast? So I'll leave it there. Probably irritated somebody on that, but Dave, I don't know if you have a thought on that or not.
Okay, well, there's also a number of comments that have came in, so I'll just, throw out a few of them because I think they reflect what y'all been discussing. Connecticut, in 2020, Connecticut experienced a 1,000 applicant increase to their RN programs, that is ADN, BSN, and accelerated from 2019. Also, we have a comment from an individual here that's on a board of a large senior service provider organization. That organization has over 100 open positions, many in NA positions, nursing aid positions. And we believe that as pay scales have risen in other positions outside of healthcare that have opened up, nursing assistants no longer want to go through the testing and isolation of taking care of seniors. Any comments, thoughts on these, like questions, comments that are coming in? Because I'm sure you've seen other things.
Sure, yeah, on the applicants, and I think we've heard something similar. I think it was from Michigan, perhaps, that, yeah, we've heard a few similar stories. And so that's fascinating. And we really, you know, I can't wait until in a few months we have the overall national picture. And if that's the trend, if that's really true, then that would really have an impact, and it would change how we look at the future compared to where we are right now. So yeah, so it is very interesting. And if anyone has heard of anything on the opposite end, chime in. I'd love to hear that too.
Yeah, I know anecdotally we've heard of increases as well, but anecdotally at this point in time.
And Dave, I think that one of the things going on is when I was mentioning that, well, it took the Johnson & Johnson and then a recession and a 911 that all kind of merged together, that really shot up interest in nursing and all the good things that occurred. We've wondered, you know, is there a 911 effect where that actually sort of led people to consider nursing, and particularly among people in their 30s who had, you know, in another profession, but then when 911 occurred, it was like, you know, is this what I want to do? Am I contributing meaningfully? I'm not that satisfied, but I've always sort of wanted to be a nurse. So we saw that surge among them. And we've wondered from the very beginning, could we see a similar reaction to COVID versus the one that I described, which was way too much negativity? And which one will sort of dominate is sort of the question that we're waiting for. And I'm glad to hear Connecticut's doing great. I want to hear good news like that. But I'm a little concerned that we may not get that.
Yeah, and on the note about the long-term care sector and aides and direct care workers, I mean, again, it's other people are looking more at this. I know some of the work of, I think, Bianca Frogner and folks, Joanne Spetz and their group. And gosh, I wish I knew more about it, but the sense I get is that, you know, that is more connected to some of the bigger picture trends that we're seeing across the whole economy, with a lot of folks who have left work and not returned. I mean, those positions are low paying. They're often not very attractive, and it seems to me like the whole sector is somewhat in turmoil. Mm-hmm. And I don't know the full story of it, but you might see just big shifts and transformations, and I don't know if they are able to make those positions more appealing and more attractive. But I know that there's also probably fewer people who are even staying in long-term care facilities, and it's so hard to. I would just be speculating on where we think that's going.
Okay, thank you, David. We are approaching the top of the hour, so unfortunately, we're just not going to be able to get to all these questions. There's several that we simply haven't been able to answer, but perhaps one more, and then we'll go ahead and move towards wrapping it up. The U.S. population is expected to grow nearly 10% in the next 10 years, and according to your forecast, the RN workforce will grow by 25%. Can we expect a considerable nursing surplus in the year 2030? Kind of a challenging one I wanted to end with.
I can answer. No, it's a great question when you think of it that way. But I will tell you that over the last 30, 40 years, the nursing workforce has has grown faster than the US population every year. This is what has happened. And yet we don't feel like we have surpluses today. We are, the demand is apparently rising faster than, so that we need more and more RNs per capita, apparently, to meet the needs of the population. I mean, these RNs are needed. There's more healthcare, the population is aging, and for whatever other combinations of reasons there are, we seem to always need an ever increasing supply of RNs per capita just to maintain the status quo. Now, I'm not saying that we have the magic perfect number of RNs already. And if you look across the country, for example, you find that in California, the number of RNs per capita is about 20% lower than it is in New England. I mean, who's right and why is that? And I don't really know. But it has just been a fact that over the last 30, 40 years, the number of RNs has grown faster than the US population. And that has seemed to be the way that it has to be. Do you have any other thoughts, Pete? It's a little hard.
No, I think it's a question people want to know, and my sense is that I don't have a lot of confidence in the demand estimates. Things happen so precariously, and look at COVID, for example. No one can forecast these things, but what we do know is this growth of the aging population that is in very nursing and needs intensive. So it's a large number, a lot of need for nursing, particularly among the frail elder. The primary care inadequacy of access to primary care, that's gotten worse. It hasn't gotten better. The behavioral mental health issues are falling increasingly on nurses. Maternal mortality, others, as you were sort of saying, that there's a big buildup of demand that I think is going to fall on nurses, and I would rather see an oversupply of nurses than I would an undersupply, even though that may not affect nurses in the way they want, but society would benefit more by having too many nurses, perhaps, than not enough. So that's sort of, an editorial comment, if you will.
It's hard to say. Yeah, I mean, you compare to other countries if you want to kind of say, well, do we have too many? Do we have too few? Eventually, we'll probably make do with what we have, but it has not been hard to continue to employ more, growing nurses per capita.
Okay, thank you, David. Thank you, Peter. I think that's a pretty good question to end on, unless y'all have any other final comments or thoughts. Okay, speechless. And once more, I apologize to those of you in the audience whose questions we didn't get to. We were simply overwhelmed a little bit today. But by all means, thank you for showing up to our event. And thank you for the wonderful presentation. It was very informative. And, there's a lot of questions left to be answered. But I did appreciate it. Thank you very much. And thank you in the audience for attending this event. We hope to see you again in the future. And just a reminder, this event has been recorded, and so will be available on our website within the next couple of weeks. Thank you, and have a good afternoon. Thank you for watching the webinar. To view our extensive webinar library and other helpful resources, please visit us at healthworkforceta.org.